Hello, everyone. My name is Abner Mason, and I am a founder and CEO for ConsejoSano. ConsejoSano is a patient engagement and patient navigation company. We are headquartered in Los Angeles, but we serve clients across the country. And while we work with all patients and all health plan members, we have a special focus as a company on low income, low health literacy, multicultural, undocumented, and other hard to reach patient and health plan member populations. I'm super excited that I'm joined today by Marcia Augsburger, who is she and I are going to have a great conversation, and I'm so excited to have her here. She's a partner at King and Spalding. She has 30 plus years of experience at the intersection of healthcare and law. She's a national expert on HIPAA, and has been a court-appointed expert understanding of these issues in managed care, coding regulations, corporate practice of medicine, federal and state anti-kickback regulations, fee splitting, state privacy laws, and of course, the Telephone Consumer Protection Act and member texting. So given today's topic is about TCPA, I don't think we could have a better guest than Marcia to talk about these issues. So thank you for joining us, Marcia.
Thank you, Abner. It's great to be here.
So let me just talk about it from my experience. I've been running ConsejoSano now for about 4 or 5 years, and we work mostly with health plans, but also health systems and providers. We work with many of the largest health plans in the country, and what we're helping them to do is to engage the members in a way that builds trust. We have developed an approach that uses a lot of data, public data, private data, claims data, to understand who people are culturally. And we've got a team of people that we have created, one of the most diverse companies around, that really understands how different people across the country consume healthcare. We built a technology platform that allows us to ingest all that data and to micro-segment the member or patient population into what we call cultural cohorts, and then design content for that cohort. So we are engaging people. We're not translating. We are creating content that's much more personalized and customized to the member or the patient. And when you do that, when you treat people like who they are really matters, it's not a one size fits all, you get better results. You get higher engagement. So we are getting great results, and we get our best results when we use text messaging, because that's what we have found that health plan members and patients across the country prefer text messaging. Asynchronous in particular, text messaging, meaning two-way, and they can wait and respond later. We found that this is true for people regardless of their income level, but it's particularly true for a lot of the folks that we focus on, lower income members who frequently, it's not just a preference for them, but this is it's a necessity. For instance, we work with a lot of factory workers, low-income factory workers, and also farm workers. They're not allowed to take their phone with them to work, and so they use text messaging as a very powerful tool for them, an effective tool. But here's the problem. Health plans that we've worked with across the country have been either unable or constrained in their ability to engage their members using text messaging. And it's also true for health systems. It is a huge problem. And even within the health plan, the operating side of the health plan wants to engage. They know this is what it means to meet members where they are and to build a more trusted relationship. But the legal side of the plan says, no, you can't do that. Even though it's 2021 and that's the way most people want to engage, you can't do it because of this federal law called the Telephone Consumer Protection Act. It's a problem across the country with health plans across the country and also other healthcare stakeholders. Can we start, Marcia, with you talking to us about what is this law and why has it been such a constraint on health plans and other healthcare stakeholders in their ability to engage with their patients and members in what we know is the preferred, most effective, most cost-effective way to communicate? What is this TCPA and why has it been such a constraint on plans?
Right, sure. So the TCPA was enacted in 1991 before text messaging was even really a thing. So it doesn't directly affect text messaging or doesn't address text messaging, but everyone agrees that it does cover text messaging. And so the TCPA imposes restrictions on making calls using an automatic telephone dialing system without getting the express pre-approval of the person called. And the problem is, of course, that unlawful uses of automatic dialers can result in penalties up to $1,500 per violation, or 3 times the plaintiff's actual monetary losses, which usually, aren't that much, especially as time goes on and text messaging time becomes free to users. But health plans have repeatedly sought exemptions from the SCC for healthcare related calls and text messages because, of course, they want to be able to send out multiple text messages to advise people of opportunities, wellness campaigns like ConsejoSano runs, opportunities to engage in educational programming, appointment reminders, various things. And so they've gone to the FCC, and the FCC has repeatedly said, no, there will be no exemption from the TCPA for these kinds of things. Now, one of the things they've said was, well, first, if just getting healthcare related calls or texts are really so welcomed by consumers, then getting consent should be easy. And second, there's no exception for healthcare related calls that is appropriate simply by virtue of the fact that they're also regulated by HIPAA, because HIPAA relates to the content of speech and that kind of thing. Now, many of us questioned whether the TCPA really did apply to text messages to known recipients, in other words, identified health plan members or provider patients for, population health purposes. But the answer to that question was really sort of far from clear until recently.
So thanks for that. So now we understand why this has been such a problem for health plans and other healthcare stakeholders. So something has happened that has completely been a game changer here, that has finally provided clarity for health plans and other healthcare stakeholders in terms of their ability to use text messaging to communicate with their patients and members. So let's talk about what has happened. What's the new thing that's happened?
Yes, there has really been a very significant decision by the United States Supreme Court, which pretty much is the body that puts an end to all of the questions for us. So what happened was on April 1 of this year, 2021, in a case that was brought initially against Facebook, the United States Supreme Court clarified what an auto dialer is all about. In that case, the plaintiff, Noah Duguid, D-U-G-U-I-D, I wouldn't even try to pronounce it, but he received several text messages from Facebook saying that someone was attempting to log in to his account. Apparently, a prior Facebook user had given out their mobile phone number and asked that Facebook text message them if someone attempted to use their or attempted to log in who was not a recognized user. Well, Noah had didn't have a Facebook account, and had never been a user. Nonetheless, he kept getting these text messages. So apparently he ended up with this with this Facebook user's former cell phone number, and he kept receiving these text messages. And so he brought action against Facebook saying, stop bugging me with your text messages. The Supreme Court looked at this and said, wait a second, Facebook's auto dialer is not just sending out text messages to random phone numbers. It's not using a random or sequential number generator. It's texting known numbers to individuals, in numbers that were associated with known individuals. And so therefore, it does not fall within the definition of an auto dialer under the TCPA, and the TCPA doesn't apply. So what that means, of course, is for health plan members and providers who have last known contact information that includes mobile phone numbers, and they want to reach out to patients, the TCPA is not going to preclude them from sending mass text messages advising them of opportunities and health care types of opportunities that they can be involved in, which to me is very good news for all of those text message recipients.
That's incredible. So I'm going to just say it back and to make sure that I've got this right, because I want to make sure our audience understands this, because I have worked with health plan leaders across the country. This has been such a struggle. And also state regulators. California recently tried to address this by their Medicaid regulators putting into place a sort of stopgap or a hack to allow plans to, in Medicaid plans in California, we call it Medi-Cal, they put in place a sort of, a way to give plans some ability to text their members. But even despite the Department of Healthcare Services in California doing that, plans in California still said, look, that's the federal law, and we're still governed by TCPA, and they were reluctant. Even today, they're reluctant to text their members. So let me just say this as clearly as I can, because I want to make sure our health plan partners across the country hear this. Based on this, tell me if I'm correct here, based on this Supreme Court ruling, TCPA does not apply to health plans when they're engaging their members for healthcare related communications, whether they use the phone or text message. Am I right?
That is correct. That is correct. And HIPAA does not preclude those kinds of messages either. And HHS has been very clear on that from the beginning. The treatment, operations, and payment exceptions apply to those messages.
So this has been such a pain point for me. I just want to sort of acknowledge that this is a game changer for health plans and other healthcare stakeholders. Before we sort of drill down and make sure that I understand what you're saying about HIPAA, because that's another issue, let me just ask this question. When did the Supreme Court make this ruling? When does it go into effect? And does it apply just going forward or retroactively? Because this law was passed in 1991. It's been a pain for a long time. So can you talk about what happens when a court, when did they rule, and when does it go into effect?
Yes. So the ruling came out on April 1st of 2021, but it interprets the statute, meaning that it is effective essentially from the time that statute went into effect. So any pending cases relating to the interpretation of what is an auto dialer are going to be affected by the case. So it goes back essentially to 1991 to the extent that the case has not already been decided in a final ruling that can't be somehow reopened. And but again, pending cases and future cases, the decision has been made.
That's great. It's kind of stunning because we've struggled with this for the last 3 or 4 years, and it's just amazing that it seems that it has been resolved in a good way. I think for healthcare consumers who health plans need to engage with. So I just want to double down on the point you made about HIPAA, which is another law. One of the big issues that we run into a lot is that people would confuse TCPA and HIPAA, and they would think TCPA requires consent, and now we know that's no longer the case. But often we would hear that HIPAA includes a requirement for consent before you can engage with a member via phone call or text message. So let's talk a little bit more about HIPAA and what is and is not required.
Right. So HIPAA has never required authorization to engage with patients by text message or any other electronic means if the communication falls within one of the exceptions, like treatment or operations, which would include appointment reminders and that kind of thing, so long as you take reasonable measures to have a secure sort of transmission. So in other words, make sure that if you're using the individual's name or you are text messaging protected information, that you've double checked that the telephone number belongs to that individual. But OCR has been very, very clear that consent is not required. And we have some links that people can go to where they can see that this is very clear. I think on the last page of the presentation, there are areas where people can check this out for themselves if they don't believe me.
Great. This is really exciting. And so now that we've talked about that the federal TCPA does not apply to health plans when they want to engage their members, and I want to encourage anyone listening here to make, particularly if you're at a health plan, we need to make sure that this information gets shared across the health plan. Talk to your legal team. We're going to have all of this information up on the ConsejoSano website. We really believe this is a health equity issue, that this is part of meeting people where they are. And the shame is that it's taken this long, frankly, to 2021, when the vast majority of Americans, if you go anywhere and you ask people how do they communicate, they don't say US mail. They don't even say email. They communicate through text messaging and particularly things like WhatsApp for multicultural populations. This has become these platforms have become incredibly popular. And the fact that health plans have been unable to engage their members in the way the member prefers is just an example of how our healthcare system just hasn't. It needs to change, and so we should applaud when there is positive change.
Yes, and one of the very interesting things about this is that this decision was written by Justice Sotomayor, who was an Obama appointee. This is a bipartisan sort of a decision, and it was actually based on grammar. It wasn't something that was necessarily about any sort of doctrinal thing. It was really a statutory construction kind of a decision. And so unless and until the legislature makes a pretty dramatic change to the law, there's no room for sort of an exception under this opinion. This opinion is very strong and very sound.
It's incredible. I just want to talk about two other things. I know we're running short on time. One is, since the federal law, we've addressed that it no longer applies. Can you speak to state TCPA-like laws? Many states pass such laws, and can you talk a moment about what those laws are and how? I won't use your words.
I'll be very quick. Yes, I'll be very quick. Most of the state laws, what we call the mini TCPA laws, don't hinge on anything having to do with whether or not there's an auto dialer involved. They depend on whether or not you are text messaging an advertisement, or you're making a call or sending a text message, make a sale. And I've looked at many, many, many cases. And typically, when they talk about sales calls or advertising calls, you're talking about a situation in which you're trying to make money. Most of the time, when a health plan is attempting to engage in population health and health management, what they're trying to do is save money and promote good health, not trying to engage someone in spending more money. So in most situations, those state laws are not going to apply, but they should always, of course, be considered.
Great. And we've got a couple of questions I just want to make sure that we get to, but you want to talk about Florida too, since this is the Florida state of reform. And Marcia, we've got the expert here, so I want to make sure I shut up and we hear from the expert, because I know that many of the folks in Florida would want to hear about what specifically is on the books in Florida.
Right. So this statute, 501.059, again, has to do with sales calls, and there's some specificity around what needs to happen if there is a sales call. And again, there, while, that this relates primarily to goods and services, and so in theory, there could be healthcare goods and services that are being marketed. Every situation obviously needs to be considered. Under HIPAA, for example, under the marketing exception, if you're marketing the goods and services of another party, you've got some HIPAA issues, right? So you're going to have consent. If you're marketing if you're a healthcare provider or covered entity, a health plan, and you're marketing your own goods and services, then you don't need the patient's authorization. So all of those things need to sort of go together and be looked at in connection with statutes, just like the one shown here.
Excellent. We've got a few questions. I know we just got a few minutes from Grayson asking about ConsejoSano's work. We're getting incredible results, and I'm happy to share with you. If you go to our website, you can find more and contact us. The approach we take, which is to use data to understand who people are culturally, and then engage with them that way, really does produce results. It's the only way to build trust. If you treat people like who they are, it doesn't matter. And you sort of have a one size fits all. Maybe you translate, maybe not, but it's still one message. That's not the way to build trust. And what we found is that customizing the approach is much more effective. And then Dylan is asking, says this is really interesting and has lots of implications for health plans' future. I couldn't agree more. This is the game changer. It will fundamentally change the way health plans can engage with their members. And for health plans, and this answers Grayson's third question, is this an opportunity to improve public trust in the health system? Part of the way you build public trust, in my view, is you have to meet people where they are. You don't say to people, you need to change, and then we'll engage with you. We have to say to healthcare consumers and members and patients, you're okay, you are who you are, and we're going to make the adjustment and meet you where you are. And part of that is, if people prefer to communicate via text message, and there's no question about it, they do, health plans and other healthcare stakeholders should use that channel. They should communicate via text message. That's the way you build trust. And get that patient and that member to open up, and then you can navigate them and work with them to enter the healthcare system at the right place and the right time, and that produces better health outcomes for them and lower costs for society. So I know we're about at time. I just want to thank Marcia, who has been a national leader on this. She has been working on this issue for a long, long time. No one knows it better than her. So I'm just grateful that she took the time to be with us here. I shouldn't call this kind of a celebration, but really it is. This is a good thing for people. It's a good thing for patients and members. And we should acknowledge that. The key takeaways are here. I won't repeat them. And you can go to the ConsejoSano website, www.consejosano.com, for more information. We'll have lots of links so that you and your colleagues in the audience can find out more about this issue. So, Marcia, any last comments?
No, it's been my pleasure. Thank
Well,
you.
thank you very much. And I want to thank State of Reform for the opportunity to get the word out about this. It is a game changer, but game changers only become game changers when people know about them. We've got to spread the word that this is a very good thing that has happened, and make sure that people know about it. So thank you again, Marcia, and thanks to State of Reform. And thank you to the audience for listening in. So long.